You've probably done it countless times, right? Walked out of a doctor's office, piece of paper in hand, often filled with what looks like, well, a doctor's secret code.
Mm-hmm.
That piece of paper, a prescription. But how often do we really stop and think about what's behind it? The history, the precision, the legal stuff even.
Not often enough, probably. It seems so routine.
Exactly. So today we're taking a deep dive into the honestly surprisingly complex world of prescriptions, this fundamental bit of healthcare we just tend to take for granted.
Yeah, and our mission here for this deep dive is really to unpack all that. We want to look at its origins, which are quite fascinating.
Okay.
Dissect its anatomy, what are all those parts, explore who actually gets to write them,
Yeah.
and really get a sense of the incredible precision and care involved.
So hopefully you listening will walk away with a totally new appreciation for this vital document. It's way more than just a scribble.
Definitely more than a scribble.
We often think of it as just, a doctor's order. But at its heart, it sounds like a prescription is much more profound. It's a set of instructions, a legal document even, like a blueprint for your health.
That's a great way to put it, a blueprint. So definition-wise, at its core, a prescription is a written set of instructions from a medical professional, usually a doctor, to a pharmacist.
For dispensing drugs.
Right, for dispensing drugs to a patient. Or if you're in a hospital ward setting, those instructions might go to a nurse or another caregiver.
Okay.
And the purpose is always centered on your well-being, diagnosis, prevention, or treatment.
Makes sense.
But what's really interesting is the word itself, prescription. It actually comes from Latin.
Ah.
Yeah, pre, which means for before, and scribo, meaning to write.
Ah, so something written before.
Exactly. It's literally something written before, a pre-planned instruction. It's not spontaneous.
That's a cool little insight, something written before. Now, beyond the word origin, you mentioned something earlier that really caught my ear, that it's a legal document. That feels like a big deal. Does its legal status mean anything specific for us as patients? Or is it more about, say, the prescriber's liability, like if there's a mistake?
Well, it's both, really.
Yeah.
That legal standing is absolutely paramount. For the prescriber, yeah, it clearly defines their instructions and their responsibility. It becomes key evidence if there's ever a dispute or an error.
Right.
But for you, the patient, it's also a safeguard. Because it is a legal document, it carries this weight that demands precision and accountability at every single step.
It's not just a suggestion, then.
Not at all. It's a direct order.
Yeah.
It has to be followed. It can be legally scrutinized.
Yeah.
And that required precision minimizes the chances of misinterpretation, which, in healthcare
Which can have really serious consequences.
Yeah, exactly. The stakes are incredibly high.
Okay, so given these high stakes, who actually holds the pen? Who gets to create this crucial legal document? Is it only doctors, or is the group wider?
Oh, it's definitely a broad range. It extends far beyond just medical doctors in most healthcare systems.
Yeah.
I mean, our sources mention specifics like those registered with the Sri Lanka Medical Council, just as an example. But the principle applies widely. You've got dental surgeons,
Okay.
veterinary surgeons, for your pets too. Their prescriptions are just as important.
Huh. Didn't think about that.
Apothecaries in some systems, even practitioners like homeopathy and Ayurvedic physicians,
Yeah.
depending on regulations.
Wow.
And maybe surprisingly, optometrists. They issue prescriptions for spectacles and contact lenses.
Of course. Yeah, that makes sense. It really shows the variety of expertise involved in our care.
It does.
So it's clear there's a bigger network of prescribers than we might think. But whether it's your GP or your optometrist, when you actually get that piece of paper, it can still look like a quick scribble.
It can look like that.
But you're saying there's actually a very structured, almost like architectural design behind it.
Precisely. It's not random at all. It's highly structured for clarity and, importantly, for safety. Think of it less like a scribble and more like a detailed blueprint. Now, typically, there are about 8 core parts to a prescription. We maybe don't need to go through every single one in minute detail, but let's focus on a few key ones that often surprise people. They show how much thought goes into each detail.
All right, let's zoom in. That famous RX symbol, we all recognize it, right? But most of us probably just see it as, I don't know, a medical emblem or something.
Yeah, just the symbol for medicine.
What's the real story behind it? How did it get so common?
Okay, so that RX, which is totally iconic, it's actually an abbreviation for the Latin word recipe.
Recipe, like for baking.
Huh. Sort of, but in this context, recipe simply means to take.
Ah, to take.
Yeah, it's a direct command, an instruction right there at the top. Take this. It's a holdover from when Latin was the universal language of medicine, a symbol instantly understood by pharmacists and doctors everywhere.
To take. That is a fantastic aha moment. So you're not just taking the medicine, you're literally taking the instructions from the start.
Yeah.
Okay, so after that clear command, take this. The core of the prescription, you said, is the inscription. I'm guessing this is the main event, the actual drug details.
It absolutely is. The inscription contains the specific name and the quantity of the prescribed ingredients. And what's crucial here is the use of the generic name of the drug.
Like acetaminophen instead of Tylenol or ibuprofen instead of Advil?
Precisely. Not just the brand name. It will also include the strength, say 500 milligrams, and the specific dosage form. Is it a tablet, a capsule, a liquid?
And why the emphasis on generic names?
Well, using generic names isn't just about avoiding confusion, because you can have loads of brand names for the same basic drug.
Sure.
It's often mandatory in many places because, 1, it significantly reduces drug costs, and 2, it makes it much easier to identify drug groups. That's really important for managing allergies or potential drug interactions.
Okay, that makes a lot of sense, especially the cost part for patients. Now, here's where it gets maybe a bit more nuanced. You mentioned a part called the subscription and another called the transcription. Can you break down the difference? Because they sound similar, but you said it's a critical distinction.
It is subtle, but really important for precision. So the subscription, think sub, like below or for, contains the prescriber's explicit directions to the pharmacist.
Okay, instructions for the pharmacist.
Exactly. This section tells the pharmacist precisely what to prepare or dispense. For example, prepare 30 tablets or dispense 1 bottle of liquid 100 milliliters. It's about how the pharmacist should fulfill the order.
Got it. And the transcription?
The transcription, on the other hand, has the instructions for you, the patient. Like getting the information across to you.
Ah, okay.
This includes the amount of the drug you should take, the time and frequency of doses, like 1 tablet orally twice daily, the route you should take it, by mouth, injection, etc., and the duration, like for 7 days.
So that's my instruction manual.
Exactly. It's your guide for using the medication properly, safely, and effectively. It ensures you know exactly what to do.
That distinction, instructions to the pharmacist versus to the patient, that's fascinating. It really shows the handover of care.
It's all about clear communication at each step.
And then, of course, the final critical piece, the signature of the prescriber.
Absolutely essential. For legality, for verification. The prescription must be signed by the prescriber's own hand.
Oh, rubber stamps.
Generally, no, especially for controlled substances. And for certain drugs, what they call dangerous drugs, it's also critical that their address and registration number are clearly included.
Okay.
It's the final stamp of authority and responsibility. It reinforces that legal standing we talked about earlier.
And I assume other bits like the prescriber's details, patient's name, address, age, and the date are pretty standard too.
Yes, absolutely. Prescriber info, patient info, the date it was issued, all crucial for record keeping, identification, and ensuring the prescription is current.
You mentioned the importance of generic names earlier, and it sparked a question. For patients, that choice between generic and brand name can seem huge. But I've also heard some people worry about generics, maybe feeling they're, not as good somehow. Can we unpack the real advantages of generic prescribing? For our wallets, sure, but also for safety.
Yeah, that's a really common misconception, and it's vital we address it. Generic drugs, by law, must contain the exact same active pharmaceutical ingredient as their brand name counterparts.
Okay, the same medicine inside.
Exactly.
Yeah.
Same active ingredient, same dosage form, same strength, same route of administration. They undergo rigorous testing to ensure they are bioequivalent.
Bioequivalent.
Meaning they work the same way in the body, they're absorbed, and act just like the brand name version.
Yeah.
So there's absolutely no compromise on quality or effectiveness.
Right.
The advantages then become really clear. Firstly, it's often seen as more scientific because it focuses on the actual chemical compound, not a marketing brand.
Less confusing, too, probably.
Much less confusion. There's typically only one generic name per drug, like paracetamol or aspirin, unlike potentially dozens of brand names for the same thing.
Good point.
This also makes it easier to identify drug groups, which, as I said, is crucial for managing allergies or avoiding interactions. And perhaps most significantly for patients,
The cost.
the cost.
Mm.
It often leads to a substantial reduction in drug costs, making essential medicines much more accessible for everyone.
That is a huge win for patients, no question. Okay, let's shift slightly and talk about the incredible precision needed when writing these things. I mean, the doses, the routes, even the abbreviations, it seems like there's this whole secret language for medical pros and getting it wrong.
Well, it has to be perfect.
It really does. And there's a detailed protocol, a whole set of rules. Not because doctors enjoy complexity, far from it. It's specifically designed to avoid errors. Errors that could be, frankly, life-threatening.
Can you give an example?
Sure. Take writing doses. You're told to avoid unnecessary decimal points. So you write 1G, not 1.0 G.
Why? Seems minor.
Because in a busy clinic or a rushed pharmacy, that 0.0 could easily be misread. 1.0 could look like 10 Jack.
Oh, wow. A tenfold overdose. Exactly.
Yeah.
Potentially fatal. Same reason for amounts less than 1 gram, you write them in milligrams. So 500 milligrams, not 0.5 G. Again, avoids confusion with the decimal.
Okay.
And if a decimal point is absolutely necessary, you always put a 0 in front. So 0.5, never just 0.5.
Why the leading 0?
Because a naked decimal point, just 0.5, could be missed entirely. The pharmacist might think it's just 5, or worse, miss the dose altogether, so the drug might not be dispensed at all.
Ugh.
These aren't just arbitrary rules picked out of thin air. They've emerged from hard lessons, sometimes tragic real-world errors. They are literally safeguarding lives, reflecting decades of learning in medicine.
Wow, those are incredibly specific rules, and understanding the why behind them makes them so much more impactful. It's not just pedantry.
Not at all. It's safety by design.
What about the routes of administration? We know pills, injections. Are there any routes that might surprise people?
Oh, definitely. While we're familiar with oral meds or injections like IV intravenous and IM intramuscular, prescriptions can specify really precise routes, like sublingual.
Under the tongue.
Right, for rapid absorption directly into the bloodstream, bypassing the digestive system, or even things like dermal patches.
The sticky patches.
Yeah, and for those, the prescription might even specify where on the body to put it, because the position can actually affect how the drug is released and absorbed over time.
Oh, way.
Yes. Think about different skin thickness, blood flow. It matters.
Yeah.
Each route, oral, sublingual, IV, IM, subcutaneous, SC, intranasal, optic drops, gargles, patches, suppositories, enemas, is chosen very deliberately.
To get the drug where it needs to go.
Exactly. Where it needs to be, how it needs to get there, and at the right speed. All to maximize the therapeutic effect and minimize potential side effects.
That level of detail is amazing. And managing all this precision often involves abbreviations, right? It almost feels like stepping back in time with all the Latin.
It does have that historical feel.
Why do medical professionals still use them? And what are some key ones we might actually encounter on our own prescriptions?
It's a great question. It is like a code sometimes. These abbreviations aren't just about doctors being lazy writers or using shorthand. Many are relics of Latin's historical role, as we said.
Okay.
They persist because they are ideally unambiguous. They're universally understood by healthcare professionals globally, which is crucial in our interconnected world. And they provide efficient shorthand, which can actually reduce errors compared to writing out longer instructions where words could be misspelled or misread.
Okay, efficiency and clarity.
Exactly. So instead of writing 3 times a day, you'll often see TDS. That stands for ter dies semendus.
TDS.
For twice a day, it's BDD bis die. QDS means 4 times a day, quarter dies semendus. Stat means immediately statum.
I've seen stat on medical shows.
Ah, yes. And for as required doses, you might see PRN, pro renata, or sometimes SOS, see opus, sit. But for those, it's critical the prescription also specifies the minimum time between doses and the maximum total dose per day.
Right, so you don't take too much.
Precisely. Like take 1 tablet PRN pain, minimum 4 hours between doses, maximum 4 tablets per day.
Got it. What about times of day?
You might see main for morning, nocte for night, vesper for evening, or just OD for once daily. It's often clearer, though, to use specific intervals like every 12 hours or every 8 hours, rather than vague terms like 3 times a day.
Okay. And routes.
The common ones, IM for intramuscular, IM for intravenous, IM for subcutaneous. They're really a language of efficiency and clarity that, despite seeming old-fashioned, has stood the test of time for safety.
So once this meticulously crafted document, full of precise instructions and maybe some Latin, leaves the prescriber's hand, it begins its journey to the patient. And that journey usually goes through the pharmacist. They play such a critical role, bridging that gap safely. What actually happens when they get that piece of paper?
The pharmacist's role is absolutely crucial. You could see them as the final guardian of patient safety before the medication reaches you. It's a multi-step process. First, there's receiving and checking the prescription.
Just taking it over the counter.
Well, yes, but it's more than that. The pharmacist should personally receive it. They don't just glance at the drug name. They read it thoroughly, top to bottom,
Okay.
and they meticulously check it. They're looking for potential problems, drug interactions, incorrect dosages, allergies based on patient records, even checking if the prescription seems appropriate for the patient's condition, if known.
So they might cross-reference with patient history.
Good pharmacies absolutely do. They check for incompatibilities, making sure the prescribed drugs won't react negatively with each other or with anything else the patient is taking or any known conditions. It's a comprehensive review.
That's reassuring, and I imagine dosage calculation is a vital step, maybe double-checking the prescriber's math.
Absolutely. It's a critical safety check, non-negotiable. Ensuring the dose is correct for the patient, considering age, weight sometimes. Then, if it's not a pre-packaged medicine, comes compounding.
Compounding, like mixing it up.
Exactly. If the prescription calls for a specific mixture, like a cream or a liquid suspension that isn't mass-produced, the pharmacist accurately prepares it. This often involves using very precise electrical balances for weighing ingredients, ensuring the exact formulation ordered.
Right. And once it's prepared or counted out, it needs packaging. I've definitely seen all sorts of bottles and containers.
Yes, and the packaging isn't random either. A variety of containers are used depending on the medication itself.
Right.
You have your standard round vials for tablets, maybe oval bottles for liquids, wide-mouth bottles for thicker creams or powders, color bottles, usually amber, to protect light-sensitive drugs, collapsible tubes for ointments, even simple paper wrappers for some powders, dropper bottles for eye or ear drops.
So the container matters for the medicine.
Definitely. It's chosen for stability, protection from light or moisture, sometimes child resistance, and ease of use for the patient.
Okay. And then the crucial part, labeling. It's not just a sticker with your name, is it?
Oh, far from it. The filled container must be suitably labeled, and the label should be affixed properly, usually on a smooth surface so it's easy to read. And the label information itself is incredibly comprehensive.
What absolutely has to be on there?
Okay, you need the type of prescription. Is it regular, controlled? The patient's full name, sometimes age or sex, the date the medicine was dispensed, not just prescribed, crucial storage conditions.
Like refrigerate.
Exactly. Or keep out of direct sunlight, store in a cool, dry place. You need the pharmacy's name and address. Often auxiliary labels are added too.
Auxiliary label.
Those extra little stickers like shake well before use for suspensions, or may cause drowsiness, or take with food. And of course, the explicit directions for use, the dose, frequency, route, mirroring the transcription part of the prescription.
So it reinforces the doctor's instructions.
Precisely. All this information ensures safe and correct use by the patient. It empowers you with the knowledge you need.
And finally, there's a less visible step, but you mentioned it's important, recording.
Yes, maintaining a system like a prescription register or electronic records is essential. This legally requires preserving original prescriptions, often filed numerically.
Why is that so important?
It creates a clear, auditable trail. It's another layer of accountability and safety in the whole process. It provides a historical record that can be vital for tracking controlled substances, managing refills, or even looking back if questions arise about past treatments.
What a journey we've taken today. I mean, from the Latin roots of the word prescription.
Something written before.
Right, to understanding it as a detailed legal document, the incredible precision needed to write it, avoiding those dangerous errors.
The decimal points and zeros.
Exactly, and then the careful multi-step process the pharmacist undertakes. Dispensing it isn't just counting pills.
Not at all. It's a complex checking and safety process.
It really is a testament to how much thought, expertise, and regulation goes into something we often just, glance at and put in our pocket.
It's a collaborative effort, isn't it? Between multiple highly trained professionals, the prescriber, the pharmacist, all focused on one single thing: your health and safety.
And I think understanding this process really does empower you as a patient.
I agree. It allows you to appreciate the immense care and the complexity involved in your own health journey, knowing that every detail, hopefully, has been considered and risks are mitigated by these layers of protocol and human vigilance.
So the next time you hold a prescription, maybe take a second look. Consider all those layers, the information, the expertise, the legal structure, all embedded within that one piece of paper.
Make you think, doesn't it?
It really does. What other everyday items, if we just stopped and examined them deeply, would reveal such intricate hidden worlds? Something to ponder.